don't know me, I'm Nazrin from Healthcare. You do know me. And I just want to say two things. One is that Manish, where are you, Manish?
I'm over here.
You're here. Manish is doing a 360 video of the dinner, and he's going to put together a short clip to put up on YouTube. If anyone, I don't know if anyone wasn't meant to be here, was meant to be somewhere else. We basically planned the whole thing. Don't feel bad. So if you really don't want to video to go up onto YouTube, then speak to Manish. That's one. The second is that we've been really lucky in that the advisory board company have been able to sponsor this dinner. So there's no place on earth, or in London actually, that you can get a 2-course meal plus wine for £25. So I just want to say thank you to the advisory board company for doing this, and it means that we can, money is not an object to attending. So I'm going to hand over to you to do a quick intro before we do.
Before we do a round of introductions. Yeah. So great. So why don't I? Is that all right for your? Yeah. I'll stand behind it so no one knows I was here. So first off, thanks again for the team at Outcomes-Based Healthcare for even putting this together tonight. This was my colleague and I, Heather Pfeiffer. This is our first of these, and I'm just so impressed that this many people get together to do this type of thing, and we're thrilled to be here. So thanks for coming. Let me do two things. I'll introduce myself, and then I'll just introduce the advisory board and who we are, what we do, and why we might be very interested to talk to some of you guys. My name again is Troy Wasilewski. I serve as our general manager of our international business, so all the work the advisory board does outside the United States. I have been with the advisory board as a firm for almost 18 years, which is a strange thing to say to a group of probably healthcare startups. Now,
no public.
What? Sorry. Yeah. Right. Exactly. Though I will say, when I joined the advisory board, we were almost a startup. We were about 180 people at that time, so a little post-startup phase. So it's taken us just. But still a pretty small firm at the time. The work that we do, I think if any of you had a chance to see our website or research us at all, we call ourselves a best practice organization. We work primarily in healthcare, though we have a separate business integrated into our firm that also works in education, so I'll leave that aside for a moment. But as a best practice organization, what we do is use a combination of research best practice, technologies, and management consulting resources to drive change and performance outcomes in hospitals and health systems around the world. So we work currently with about 4,500 hospitals around the world, and an increasing number of non-acute providers as well, whether those be GP practices or primary physician groups or post-acute care facilities. And that is across about 54 different countries. So a relatively large footprint of the number of organizations we work with. Those three categories of work, I'll describe them very briefly. The core of the advisory board is this best practice work, and it's where we started. We started as a research company, we'll always be a research company. We have about 1,000 research staff dedicated to the advisory board who basically try to figure out and study every year what the top concerns or problems for hospital health system executives are on a daily basis and what the answers to those are on an annual basis. So for example, we survey the world, and we survey regionally, we survey at a country-specific level and ask chief executives or chief nursing officers or directors of operations or directors of finance, what are your most pressing issues? And then our teams will go out and find the already best demonstrated practices that other innovative organizations around the world are using to try to solve those issues, whether they be process-based or strategy. And then we publish those, and then we work with organizations to implement those ideas. On the technology side, probably more relevant to the folks around the table today, we have over time launched a series of business intelligence and workflow tools designed to help hospitals, health systems, and increasingly, again, other members of the continuum of care drive outcomes and performance. Just to give you guys a sense of the scale, in the United States, which is our original home market where we do most of that work, about 2/3 of all inpatient admissions flow through one of our data tools at this point. So there's a huge database there, but also a lot of tools that we're using to help drive performance improvement and outcomes. And then, of course, the management consulting side of our portfolio probably speaks for itself. We'll often bring to bear management consulting resources to help hospitals change. Outside of the US and here, particularly in the NHS, we have an ambitious agenda of growth ourselves. We're probably feeling much more like a startup here in the NHS than we do in our home market in the US. We work with about 2/3 of NHS trusts in our research group, but we are very interested in expanding the impact that we can have, not only here, but also in continental Europe, Australia, and Canada, and abroad. And I think as a buzzword that might be of interest to this group, where we're sort of centering our strategy and a lot of the work that we're doing is putting together a series of solutions, including investing in firms or finding other ways to partner with firms that can help us around reducing unwarranted care variation. So we see that as a critical component for really any developed healthcare economy that is looking to take the next stage of not only driving efficiencies, but also improving outcomes for their patients, and doing so in an environment that demographically is changing under their feet, and where the mission of the organization may stay the same, but the way that they deliver on that mission is going to have to change dramatically. So that is a centerpiece of the work that we're doing. Heather and I, Heather heads up all of our international strategy, are actively looking for organizations to learn from, to partner with, to work with, to help deliver a comprehensive set of strategies around reducing unwarranted variation. So on that topic, we'd be thrilled to chat with
push
people.
everyone to me.
Yeah. No. I'm going to drink wine and you can
All
talk about
40
that.
people.
But on that topic, but on any others, we'll be excited to chat with you guys tonight. Great.
Brilliant, thank you.
Thank you.